Keratoconus leads to irregular astigmatism with significant coma, higher order aberration, impairing vision. Early diagnosis is important to allow for corneal cross-linking, which delays or halts progression of disease. CXL can be combined with topography-guided excimer normalization to improve corneal shape, decrease cylinder and HOAs, and improve visual rehabilitation. The Alcon topography-guided software uses corneal higher-order Zernike coefficients from the high-resolution Placido scan to generate an eye-specific HOA ablation map. This is then used to remove small amounts of corneal tissue within the spherocylindrical ablation. This treatment map graphically represents the shapes, locations, and depths of the excimer laser tissue removal patterns that are delivered onto the cornea to correct the anterior corneal HOAs. Here, an example of topo-guided PRK with CXL to treat keratoconus. The workflow calls for reviewing the HOA ablation map to verify agreement with the anterior corneal elevation before treatment. A distinct similarity was seen in all keratoconus ablation maps. These treatment maps have never been used in a diagnostic capacity. We set out to identify objective map features to determine this imaging modality's diagnostic feasibility for KC. The findings presented were published this year. Consecutive eyes diagnosed with keratoconus were analyzed with Pentacam, OrbScan, OCT epithelial mapping, and Corvus biomechanical metrics. Pentacam, Belin, ABCD staging, and the modified Amsler-Krimic grading identified grade 2 and up keratoconus. All map patterns were quantified using novel descriptors. The data revealed keratoconus maps having similar features. We found 3 distinct identifiable ablation islands in 100% of eyes. At a quick glance, this novel, highly recognizable pattern is what keratoconus looks like. There's a deep peripheral superior ablation crescent, a shallow superonasal ablation ellipse in direct opposition and mirror-like to a deep inferotemporal ablation ellipse, which was found to be coincident with the apex of the cone. The average ablation depth of 70 microns is 9 times higher than normal. The characteristic arrangement explains the differential corneal ablation required to correct the localized corneal elevation at the cone apex. The pattern is comparable to the vertical coma-dominant arrangement recognizable on wavefront maps in keratoconus seen here. But HOA ablation maps not only provide a quantitative measure of aberrations with ablation depth, but also localize them on the corneal surface. Such a high coma pattern would develop with any cone position. These reproducible ablation islands had their characteristics analyzed with our custom-created software. 7 highly reproducible quantitative parameters from 4 ablation islands were derived, and they are listed here. This is an overlay of the data points onto the average map. The descriptors were highly reproducible. High ablation depth had the greatest variability, indicating that it could correlate to KC severity. Ablation depth is also directly correlated to HOA magnitude. Strong correlations were also found between the depth of the inferotemporal island and 8 Pentacam indices. Coma-like aberrations have been shown to be good indicators for early detection and grading of keratoconus, but with false positives. The HOA ablation map provides additional information related to position, eccentricity, depth, orientation, and shape of anterior corneal HOAs. This may improve diagnostic ability beyond just Zernike coefficients alone. Here's an example of inferior steepening of 2.5 diopters. We see normal Pentacam imaging and indices. Normal Corvus biomechanical indices. Epithelial mapping normal, not showing localized thinning as in keratoconus. Here we see high HOA ablation, but the pattern is opposite to keratoconus with temporal crescents and nasal deep ellipses that are very symmetrical, not in keeping with keratoconus. Another example showing greater inferior steepening in OS of 1.5 diopters. Pentacam indices are normal. Corvus normal. Epimapping is indeterminate. Here we have high HOA ablation depth, map parameters consistent with keratoconus. We hope to create a scoring system based on these new map metrics. In conclusion, novel information can be extracted from the corneal HOA ablation map, giving it the potential to be a new modality to diagnose, grade, and monitor progression in keratoconus and post-op ectasia. Thank you very much. Please visit our research website.